Hi, everyone. Welcome to Friday, May 1st, our webinar on arts and the intersection of arts and health. And we have some amazing guests here who are experts in their field, and we're very, very lucky to have them with us today, taking some time from their very busy jobs to share with us some of these practices that you can be learning about in working in arts and health. And we're just going to wait a couple more minutes before we get started. We've got over 100 people signed up, so we're happy you're here with us, and we just want to make sure that you get a chance to come in. As you're doing that, I'll introduce myself. I'm Julie Baker. I'm the Executive Director of Californians for the Arts and California Arts Advocates. We just finished celebrating Arts, Culture, and Creativity Month, which is designated by the state of California to be every April. Of course, in our minds, that never ends. We want to celebrate and recognize the impact of the arts, culture, and creative sectors every month, every day, as it were, in the state of California. But we have a special designation in April. So we were happy that many of you, I think maybe there's some crossover, participated with us during Virtual Arts Advocacy Day on April 15th. And we have a lot of things in terms of advocating for the arts, culture, and creative sectors right now in the state of California, as well as federally, making sure that there is funding and attention paid to our sector, that we are at the table when decisions are being made. And so if you are interested in learning more about our advocacy efforts, please visit our website, californiansforthearts.org. I'm just going to give it one more minute, see how many more folks roll on in. And just some housekeeping. If you want to introduce yourself in the chat box, it's really fun for the panelists to know who's here, as well as if you have questions, please put them in the Q&A box. The chat box tends to get fairly crowded with people saying hi and introducing themselves. And so if we want to be able to pull that out towards the end with Q&A. So if you could add that into the Q&A box, that would be terrific. All right. Do is actually get us started so we can maintain our schedule and honor those who have dedicated an hour this morning to share what's happening in the arts and health sector here, specifically in California. And it is my pleasure. I'm the Executive Director again, Julie Baker of Californians for the Arts, and we've been doing these online learning sessions. We will continue these, and we will be continuing going forward with a series, arts and public policy issues. So look for more of those as well. And it's my pleasure to get us started to introduce Naj Wyckoff. And Naj, why don't you take it away and introduce yourself and tell us what we can expect today.
Well, thank you very much, Julie. Thank you very much for giving us this opportunity. My name is Naj Wyckoff. I'm the Vice President of the National Organization for Arts and Health, and I'm also a Marketing Director for Aesthetics Inc. And we're based in, both the organizations are based in San Diego. And I'd say one little thing about the National Endowment for the National Organization for Arts and Health. You know, our mission is to unite, advance, and serve the field of arts and health. So what's the field of arts and health? The arts and health includes artists, creative and expressive arts therapists, and architects, interior designers. It includes arts administrators, doctors, nurses. These are people who are working in public health, in medical care, and in medical education, and also like in terms of the design of the physical spaces. And you're going to learn a lot about that over the next 40 minutes. We have a terrific lineup of great speakers. And the vision of NOAA, of course, is for arts and health to be an integral component of health and well-being. And a lot of some of the most imaginative and terrific programs in arts and health are taking place in California. And next September, whether it's going to be in person or over the web, something like this, or a combination of the two, the National Organization for Arts and Health will be holding its national conference in Long Beach, either in Long Beach or out in Long Beach or featuring Long Beach. So this is a terrific opportunity. But without further ado, we're going to start off, we're going to sort of talk about three big things today. The first is an overview of different examples of how the arts are working in these different areas that I just described. medical care, public health, medical education, as well as the design and the creation of the physical spaces. And then we're going to focus into the arts and COVID response. Okay, so I'm going to start off by passing the baton to Annette Ridenour. She's the founder and president of Aesthetics Inc., and she will introduce herself a little bit further.
Okay.
Annette, you need to unmute yourself.
I am, okay.
Okay, there you go.
Okay, hello again. Hi, I'm Annette Ridenour, founder and president of Aesthetics. For the past 40 years, I've been involved in the facilitation design of visual arts programs in hospitals throughout North America. And we've had the opportunity of working on quite a few really large hospitals here in San Diego. And so for the next 4 minutes, I'm just going to share a little bit about why the arts are so important. Here we go. Why the arts are so important, the visual arts in health and healthcare. Artwork is a fabulous tool to tell stories and educate about the communities that you live in. It's wonderful to celebrate the quality and creativity of regional artists. We have the opportunity of engaging with our regional museums and cultural centers. We have the opportunity to use large pieces of artwork to reinforce branding and wayfinding. Through doing a deeper dive, working with clinicians and designing specific artworks, we can emotionally support specific patient populations, improve the patient satisfaction scores for a facility, retain employees. A very important part is celebrating diversity and inclusiveness of our community. And in many cases, actually become an art destination for your community. This has happened in several hospitals in California, including Cottage Hospital in Santa Barbara and one I'm going to talk about, Lucille Packard. Demonstrate the role of art in spirituality and healing, and build and reinforce your donor base, and actually through evidence-based design, add to the research base. So I'm just going to share you a couple of slides of an expansion project that we worked on at Lucille Packard Children's Hospital that was completed in 2018. Commissioned original sculptures to help designate each of the different patient units and say hello and be ambassadors to welcome the children to the hospital. Looking at telling stories of ecosystems. These are California least terns. There's 100 of them that are flying in the lobby. Also in the lobby are these mosaics that are trompe-l'oeil mosaics that become the engaging pieces of artwork for children and adults for the whole area of discovery. Using digital art, interactive multimedia is something that's being used more and more throughout healthcare. Digital art, this is a very large digital mural that was printed on metal, and it became a almost like a seek and find, finding the animals that are in the region for children and adults. All media is used in healthcare. So these are some wonderful sculptures by California artists Michael Cohn and Molly Stone that talk about the different ecosystems from a sculptural point of view. And telling stories. We have the opportunity of telling the stories of the history. Stanford campus is iconic for its buildings, and so a sculptural ball machine was created for that. Gardens, discovery and play, as well as mosaics being used for discovery and play. So there's a whole opportunity. Spirituality, the idea of commissioning artists to reinforce the spirituality of the space. And Jeffrey Laudenslager created an amazing sculpture, a wind sculpture that is the logo of the hospital. sport wayfinding, a wonderful piece of artwork that is used to assist patients to go from one building to the next. And the other thing I just want to explain is that there's wonderful opportunities to engage all of the different museums and cultural centers. And a few examples. Here's one in which the Space Theater in Vancouver actually redesigned a whole high-tech area. And what a great way for the Museum of Anthropology to depict the great culture in the area of Vancouver. So with that, I'm going to turn this over to Alan, who's going to talk about the next subject.
Hi there. I'm Alan Siegel. I'm a family physician, and I've always focused on well-being within medicine. In my early days of medical school, I used to go to medical conferences, and we'd have pretty deep conversations about how to stay sane in the midst of this pretty crazy medical world that we're getting into. I am a family physician in Contra Costa Health Services in the Bay Area. I've been here for 21 years, and I've played guitar and piano since I was 8. These two passions came together in the world of arts and health. I've been running an event at my hospital for the last 13 years called Healing Through Creativity, and that's how I connected with the original members of my band, The Rhythm Method. In the last 9 years, I've run a program called Art of Health and Healing through my county health system. And there are 3 major areas that we wanted to do. But the addressing staff and staff wellness has been one of our 3 priorities, and that has been the hardest one to do. The mantra in healthcare is really that it's all about the patients, and it's very hard to break through that mantra. So the idea that we put on our mask first and take care of ourselves is really a foreign concept. I joined the NOAA board about 2.5 years ago, and I work on building regional networks around the country, including we have one called Arts and Health California. And we're developing ways to bring our artists together, our arts therapists, our healthcare workers, our state arts councils, and to really think about networking, connecting, sharing best practices, to really rising the tide to make this more of the rule in healthcare rather than an exception. I have had my own burnouts in my career twice. I think that has happened once in the late part of residency. That was pretty severe, and then one an early part of my academic practice. And as I've learned more about burnout, I've really realized I don't think it was such a common thing to talk about back then, but that burnout seems like a pretty clear part of what I've been through. I thought at the time they were just depressions, but really had a lot of factors that go along with work and the things that go along with burnout. And I have realized that bringing the arts to this public health emergency, that I could make a difference. And so it seems like the place that I've wanted to do. I don't want other physicians to suffer the way that I did, or worse, I don't really want to lose any more of our comrades like we did this week out of New York. So back in September, I coordinated a pre-conference around clinician burnout and well-being. And a lot of people were interested and motivated of how to work on this and how to bring the arts to it and bring it back to their programs. So as a priority for NOAA, we brought this issue to our leadership summit in DC in January. And with an amazing working group, we built a strategic plan and have been starting to roll it out. But then as COVID has come along, we realized that we need to rise this up to a higher level and move into high gear. So our healthcare system was really in trouble before COVID, and I have to be a little bit afraid of what will look like for our workforce after COVID. I've never seen the stress level of our nurses and doctors around the country as they are during this. My own brother works in an emergency room and runs the ER in Virginia Beach. And the level of stress that this has brought on, I've just never seen that. I also work on some of the front lines working in a COVID tent. And it's just very intense. I worry about bringing the disease for myself. I worry about bringing it home for my family, for my small children. So it's real. And I think secondary trauma is real. So we really need to bring the arts to this struggling group. It's good for them and their well-being. It's good you want to see doctors who are not burned out, less errors. It's a safer environment. We have better access. So it's really important to take care of our providers. And among the many solutions brought up for healthcare around burnout, throwing out the system we have, starting a new system, changing the EMR, bringing in less patients per day, lots of things like that. Bringing in the arts really is the easiest and simplest of those solutions. And I think it's a healthy way for people, clinicians, to deal with stress. So we want to use these powerful tools, and we need all of you artists and art therapists to really continue to help us heal. And now I think we'll pass it on to Cindy Perlis.
Cindy, you need to unmute.
I'm an artist. I'm that artist who used to go to bus stations and train stations and airports and draw people. I worked at the Smithsonian and did research in 18th and 19th century American painting and sculpture. I love this work. I am deeply passionate about it. And in 1988, I was hired to start an art program at the University of California, San Francisco Medical Center to work with patients who at that time had HIV. The oncologist who hired me literally hired me in 15 minutes, walked me upstairs to the HIV unit, told me to put a mask, gloves, and a gown on, and sent me in to work with the first patients. So thrown into a war zone at a time where I felt that art would really help people heal. I went into the first patient's room. I sat down on the bed. I said to this very young man, "You must be really afraid." He looked at me and he said to me that nobody's really let me talk about how afraid I am, that everybody keeps coming in here telling me I have to have hope and I have to be positive. And to be quite honest, in 1988, there was no cure for AIDS and no one knew what the future would look like. I would sit with the patient. I'd ask them to tell me their stories. And, I always say there's something to be said about being naive, because very soon after I entered the room, I would take off my mask because I couldn't breathe. And I'd take off my gloves because I like to touch. And for whatever reasons, I wasn't afraid. And my mother was calling me from 3,000 miles away saying, "What are you doing? Are you okay?" And I had found that I had actually come home. I had loved this work so much that I felt that in my lifetime, this is where I was meant to be. I would walk out of the patient's room after staying with them and listening to their stories and helping them to express what they were feeling with this blessing in my hand, with this artwork in my hands. And I would show it to everyone who would look at it. I would show it to the nurses, and I'd show it to the doctors, and I'd show it to the surgeons, and I'd show it to the family members who were around, because as you might remember, in the days of HIV, many people were disowned by their families or their partners had died. And so they were isolated and alone in the hospital. Pretty soon I was invited to grand rounds at the hospital because I could tell the stories of the patients through their artwork in ways that the physicians or the nurses couldn't tell the stories. So that's how I began my work. I am deeply passionate about it. And a hint to all of you who might want to be starting art programs, I really pushed my success towards understanding what it means to raise money, so I could do what I needed to do without having to continually go back to the administration of the hospital to ask for permission. The young men had no visitors at that time. They were really isolated and alone. But the real beauty was that they would bring rocking chairs and quilts into the bedrooms, and they would be there with feelings of home and safety while they were there. So soon I had an office after starting so quickly. And soon I learned a lot about fundraising and grant writing and all of that. And soon I realized that the medical students were coming in and they were asking me a lot of questions, like, I was a musician, could they play a violin for the patients? And so I started incorporating all the medical students who were musicians and writers and poets and dancers into our internship. And I was able to arrange with the medical school so they could actually get an elective for participating in all of this. So there's many other things I could tell you, but I'm really happy to be here today, and I look forward to your questions, so hopefully we can answer them. The most important thing I want to say is how beautiful is it for all of us as artists to be in a community together today. Thank you.
Napoleon?
Yes, hi, hello everyone. I'll echo that. Definitely is an honor being here today. My name is Dr. Napoleon Dargan. Also go as Dr. Q, and Q is for quality over quantity. And it also represents this culmination of work that I've been doing over the last 10 years that has been designed and dedicated to actually ensure that everyone, particularly people of color and people of low socioeconomic status, have access to high quality, culturally competent, integrative healthcare through the arts. Today, I'm actually going to be talking a little bit about QOQ programming, and specifically one of our earlier programs called Stress Reduction Through the Arts, which was a focus on hypertension and nutritional wellness. This program was actually forged as I was actually studying integrated health psychology, writing my dissertation on health disparities and the things that actually contribute to the disparities, like cultural mistrust, healthcare stigma, the stigma around engaging healthcare services in general, looking at how can we utilize the arts to not only engage, but sustain healthcare practices. All of this was actually coming to me as I was also forging an art-based group called Art in the Lobby. I was getting some traction. I was getting maybe 9 people per session in comparison to our contracted behavioral health coaches. I was getting maybe 5 to 6. And I said, hey man, something is going on. We have something here. And I continued to research it. And boy, did I find out that we were actually following a lot of the healthcare disparity points of how can we actually close the gap utilizing the arts. And I found these 4 things that we rest on in QOQ. One is the research says in order for us to actually close this gap, we have to create innovative programming that, one, says that it's okay for you to be exactly who you are, and you can actually show up how you are and not feel like you have to speak through this white mask, through this white filter. The research on health disparities says that often, you know, in white institutions, it's this felt sense of not actually being able to speak from a cultural place of origin. And then when we're doing that, talking through this filter, you can see how that actually impacts our experience of healthcare and sometimes our inability to get our healthcare needs met in an authentic way. So that's one. Our second pillar in quality over quantity programming is around creating spaces that create this felt sense of togetherness, cohesion, brotherhood, sisterhood. The research says, hey, when we look at health disparities, a lot of what comes up is when you look at cultures, low SES, that's low income, low education, low insurance status, they often tend to come from more collective of backgrounds in nature. And then when we transition into often these white institutions, it's one-on-one in a white coat. And that in itself can be a place of contention to engaging in healthcare or preventative care for that matter. So not only in quality over quantity do we create spaces where people feel that they can, one, come as they genuinely are, two, create this felt sense that you belong here, we're in this together. Our third factor is educating our participants, utilizing the arts paired with evidence-based psychoeducation interventions. Man, I have yet to find something more powerful than the arts to actually not only reach, but to help our participants identify and cope with a lot of common behavioral health concerns. Our fourth factor, though, which is our Q factor, is actually serving the culture through the lens of gratitude. So I say that to say the program that I wanted to highlight today was a program called Stress Reduction Through the Arts, Hypertension and Nutritional Wellness. This program was actually developed as I was studying stress management. And can you imagine there is a link between stress management and how we can manage our hypertension? But I say that to say our group following our formula and those 4 pillars have definitely gained attraction for being able to serve our culture, our community with excellence. We actually had a workshop. We were funded for 10 weeks, 2 5-week rotations. It was aimed towards, again, high-risk community members. We use multimodal arts. I think another thing that makes quality over quantity so effective is when we look at the public healthcare system, there's such an expectation of quantity over quality. When you look at the plethora of services that just this one program provided, from free childcare, gourmet food made on site, prepared and served on site, being educated on what made that food nutritious. Also too, the hands-on art interventions paired, I believe, with this idea around utilizing the arts to increase our cultural competency. That is, who am I, who is the other, and how can we actually close this gap? Because in closing that gap, we're actually closing the disparities gaps too. So in this process, not only did we create something that felt good, so much so that at the end of our 2 5-week rotation, every single participant rated our process a 5-star in its overall general experience. Every single participant. Not only that, that it felt good, they also reported a significant reduction in their ability to identify and reduce symptoms. In our group, we had 56% of our population come in at moderate to severe depression symptoms. In just 5 weeks, that went down to 12%, coming once a week on Saturdays for 3 hours. Our anxiety severities is even more dramatic. At the beginning of our 5 weeks, 94% of our participants came in with severe anxiety diagnosis. And just in 5 weeks, we knocked that down to 22%. I don't know medication that's doing that to some degree. So I say that to say I've been so impacted by the arts, being an African-American from a low background. I'm so proud to be a part of an organization that is not only utilizing the arts for common behavioral healthcare practices. We just actually completed this module that is around addressing pediatric obesity with our teens in Richmond, California, which we currently at the time had no groups before that. We're currently also moving into our HIV, STD demographics. And again, I'm just honored to be a part of an organization that's continuing to show us that the arts is here to stay, and that if we plug into them, they can actually inform us and guide us to a pretty transformational path of wellness. So I feel really honored to be here with you guys today. I look forward to answering questions.
Well, thank you very much, Napoleon. I just want to add very briefly, one of the areas where the arts work in medical education is using the arts to improve observation skills of medical students. And so as an example, medical students we brought to a museum and looking at works of art and using the works of art to really help them see, really help them, get a better sense of connection. So now what we're going to do is we're going to shift, build on what both Alan and Napoleon said a little bit. I'm going to bring it back to Annette to talk about, first an introduction of COVID, which 19, both the National Organization for Arts and Health and the Center for Healthcare, the Center for Medicine at the University of Florida are really great catch-alls for learning how you and the community can use the arts to help address the COVID crisis. So Annette, we're passing the baton back to you.
Hi, everybody. I'm going to share my screen again, and I'm going to share a couple of slides and then a video. Let's see how we do this here. Sorry. Okay. So if you heard a lot of passion today, it's because you heard a lot of passion. The people who are the leaders and participants and members of the National Organization for Arts and Health are extremely passionate about how the arts play an effective role in healing. So when a crisis like this happens, NOAA mobilizes. So we actually mobilize this COVID-19 creative response, and I would really encourage you to go visit our website. There's an enormous amount of material there. We have a volunteer committee that has been working for the past month to accumulate all kinds of arts projects and videos that artists have created that can be used just for general public health to demonstrate the impactful role that the arts have on our own personal healing. So this is a very exciting project that's going on, and I just want to invite you to not only just view this, but to participate. It's sort of an open response here for any artists or arts administrators putting together programs. And while we're talking about NOAA, I just want to shout out one more really important component is that for the past several years, NOAA has been putting together a core curriculum. And this core curriculum is going to lead towards a certification for artists who want to work in healthcare and for arts administrators who are working in healthcare. So it's a very, very exciting opportunity for us to really expand the field and demonstrate to the healthcare world the value that artists bring to health and healing. So with that, I would like to show a little video. Right, Alan? We're on the video. Is that next?
Yeah, let's show the video first, and then I can tell you about this project.
Okay, so hopefully this works. Wrong slide.
Here's the title.
Video link, okay. All right.
So while it's getting going, we're going to talk to you about a project that we're doing called Noah's Ark, that the video we just finished a couple days ago, and helps show you about the project. Hopefully it will come up, but it's Noah's Ark, Arts for Resilience in Clinicians. And so I'll go ahead and speak, and then hopefully the video will come up.
Well, Alan, do you have a better, I can stop sharing, and do you have another one on your desktop? This is the last one I have.
Yes, I can probably get to that.
So I've stopped sharing, and I'm gonna let you share and see if you can take it.
All right. Why don't I just talk a little bit first, and then I will break off for a second and get the video for us. But as COVID was heating up, we decided that bringing our art therapists and artists to support our clinicians was a big priority for NOAA. And NOAA provided $10,000 seed money to start this project. So this project, as I mentioned, Noah's Ark, Art for Resilience in Clinicians, will bring videos and virtual support programs for small groups and individuals of clinicians. We'll start off with 6 different hospital systems, including UCSF and my hospital system, Contra Costa Regional Medical Center, and then as well as 4 other ones around the country in Minnesota and New York and North Dakota. And we will start with that as phase 1. And then our hope is that as we bring in more funding, we can expand and be able to really offer this to all people around the country. So for some people, some of our clinicians, this will be an introduction to how the arts can help them survive and thrive in the long game through this pandemic. And then we go back to the usual epidemic of burnout that I was talking about before. And we want to start this now, since obviously the need is great, and then continue once the dust settles to help clean up the mess. We hope that the arts can become an integral part of our healthcare workers staying sane and bringing balance, along with other things that, you know, I think have gotten more acceptable, like mindfulness, exercise, being out in nature. Those things more and more people accept, and the arts is sort of scary, and creativity is scary to some people. But I think that this is a very strong tool that we really should become part of the mainstream. So I am going to pass over to Cindy, and I'll work on getting the video ready. Cindy's going to continue talking about our project if she gets off mute.
Hi, everyone. First, I want to say thank you for joining us today. It's really great that you took the time to be a part of this webinar. We really appreciate it.
Mhm.
So during my 32 years at UCSF, I watched as physicians dealt with stress and burnout. I watched as some quit work, actually, or they worked longer hours because they felt guilty for leaving, or they relied on drugs, or they're divorced. There were all kinds of issues that happen with physician burnout. And I feel as artists, we have a responsibility to give back. We have to show the world what we have to offer, how we can help those heal who are hungry for the tools that they need. Tikkun olam means to repair the world. We need to behave and act constructively and beneficially because we are artists. We are teachers. We can be mentors. We can show the world. We can create dialogue. We will be soliciting artists, musicians, writers, poets, and dancers to submit videos and ideas for virtual rooms where clinicians can participate in their own time, maybe at midnight, or maybe early in the morning, or maybe when they have a break, to stop, to move, to dance, or maybe to recite a poem in a virtual room, to draw an image from a prompt, to find community where they are not alone, to express their grief. We will be looking for artists who have experience working in the healthcare setting, who are resilience informed and trauma informed, and most importantly, good listeners. We're looking for a diverse population of artists who are passionate about lifting the spirits, providing a safe space where these stories can be held. And one more thing, you should all go to the NOAA website. This organization brings all of us together in remarkable ways. We need each other, and we especially need each other right now. You will be supported. You will be heard so that NOAA can meet your needs. And most importantly, you will belong to a community of like-minded people. If you are interested in submitting any kind of a video, please give your email to the California for the Arts, and we will be in touch with the questionnaire. Thank you so much. Be well, stay safe, and here's our video.
Alan, you need to share audio.
Yeah, right.
So maybe we should go
I'll
move
go ahead
on
and
from
go into the video.
Yeah.
I think
yeah.
I think we'll move on from. Oh, here goes.
Can you hear it?
Healthcare workers today risk burnout with the constant pressure to save our patients, our communities, and our parents and grandparents. But there is hope, there is help. Sometimes all it takes is a brief release. A break from the stresses of the day, a time to unwind, a time to create.
The National Organization for Arts and Health, or NOAA, brings the arts to healthcare providers around the country in a challenging time. The arts have been shown to relieve stress and help build resiliency for healthcare workers. They're an escape, a way to rejuvenate and refresh so we can go back to providing excellent care for our patients and for you. NOAA's ARC, Art for Resiliency in Clinicians, will offer professional quality videos and live virtual sessions included in the arts, including movements, poetry, drawing, and music from expert artists and art therapists for your nurses, doctors, and other healthcare workers.
With your donations, we can help our medical heroes manage stress and continue to fight on our behalf.
Any help is appreciated and can support artistic expression for those working hardest to heal our communities during this pandemic. We are deeply grateful. Thank you.
Okay. I want to thank you very much, Alan. A couple of things, we have some questions I'd like to get to, so we can start bringing that up. I just want you to all know this is this program uses both creative and expressive arts therapists as well as artists. You know, both are very valuable. A creative arts therapist or expressive arts, these are board certified. They're highly trained individuals and using the arts for a therapeutic outcome. And professional artists working in healthcare, they're not there doing therapy. And there might be a therapeutic benefit for what they do, but that's not their area, their scope of practice. So I just want to make sure there's a real distinction between the two. They're very complementary and the best programs have both. So some people, and I also want to say that what we're trying to say here is Californian artists and creative arts therapists and architects and interior designers are having a profound impact. And that's program has literally spent millions of dollars on California artists commissioning and purchasing their works of art to help decorate hospitals. And then you think about the number of artists who are working in the hospitals and public health. You guys are having a tremendous impact on the health and well-being, and you need to make sure that your senators and so many people in Sacramento know how important the arts are to really upholding the health and well-being of all Californians. Now, some people have asked, how do I get into this field of arts and health? So do any of you have some answers to that? Annette, Cindy, Alan? Somebody wants to know, how do we get into the field of arts and health, these second responders, as they are being called?
Yes, I feel that you should speak to those people who are involved, network like crazy, contact people, find out how they did it, what their experience is, because I can assure you that every one of our experiences is completely different as to how we got into this field. This is a beautiful field. It is a place for you to express, not only to express your feelings and your own art, but also to give of yourself, to give back, because you can.
You know, I will.
Go ahead, Napoleon.
No, go. I'll go with you.
Well, again, I want to tell people to join NOAA. You know, at any particular level, NOAA is the advocacy and education pillar in our community. So we have regional conferences. So San Diego, California, there's a regional conference that we're going to be having. And then there's a national conference that's going to be in Long Beach in September. And if we can't meet in person, then it's going to be a video conference. But get on to NOAA, and that's really a great entry point to meet people like myself. There's people like myself working all over the country that are continuously looking for artists. So again, join NOAA, go to NOAA, you know, we are the resource.
Now, California, I just want to, I'm sorry.
Okay, go ahead. Well, I was going to say, I just want to, there's some more questions out here. So I think this is more for Annette and Cindy. People are asking, how do you talk hospital executive or the head of a public health department into supporting the arts as part of their program? So well, Cindy, how did you get your CEO's attention?
Well, I'm going to tell you more recently. I retired January 11th after 32 years. And when I went to the administration and told them I was going to retire, they freaked out, basically. And they did a national search, and we found a very wonderful person as my successor. But they are determined, and we're determined to continue this program. This program had become a department in a big university and had reached out, you know, to the bone marrow transplant unit and to the physicians and to the medical school and to help everyone to come together. You know, I used to love to do open art workshops where there was the housekeeping person and the engineer and the person who cleaned the hospital rooms sitting next to the physicians and sitting next to the patients. I think it's just really the community that we need to have. At the beginning, I realized that I needed to learn how to raise money. That was one of the most important things, and to write grants, because if I came with my own money or could raise my own money, I could make them look really good. And and I could come up with all my ideas and I could present them and I could have money to support them. And the other part is marketing. It's really important to market a program and understand how to do that well. And the other thing that I've learned is to always say yes. At the very beginning, when someone would come to me with an idea and I would think, oh my God, I don't know how I'm going to do this, I would figure it out, because I wanted to reach across the campuses to make sure that everybody knew about the program. And one other thing I think is really important to mention is grief. There's a lot of grief in this work. There's a lot of sadness. Hold the space for people who are dying. And how do we as artists, I always say I'm so fortunate that I'm an artist because I don't know how other people express those feelings. But I think it's really important too, in any hospital, to work closely with the chaplains, to have relationships with them, and to have them join into the programming that we are doing. But I think moving forward, I think just talking to people, as many people as you can, who are successful and working in this field, so that you can understand what it involves. Because we invite everybody. We want artists and musicians and poets and writers. We want art therapists, we want expressive arts therapists, we want drama therapists, but we want people who are in the drama world. We want dancers who may not have any licensing. And we want artists who just create and look at this work in a different way. So everyone is welcomed. And again, NOAA can be a repository for all this. And you know, this is exciting. We're really on the edge of doing something big, and we need all your help and information and expertise.
So just to be very specific in terms of a hospital CEO, when a hospital CEO sees patients' satisfaction scores go up because of the arts, you've got their attention.
Right.
When hospitals see that staff turnover is reduced because of the arts, you get their attention. Right. And so to give you an example, is the National Organization for Arts and Health a couple of years ago decided to find out what it is that wakes up hospital executives, the heads of medical schools, the heads of public health officials. What do they wake up in the middle of the night, 4 in the morning, and worried about? So we brought them together along with various agencies that support them and asked them that question. And that's where we found out burnout is a big deal in medical school. It's a big deal in public health. It's a big deal in medical care. The growing issues of health disparities has them, really concerned. And what's coming? One of the things that's coming out of this COVID crisis, as an example, volunteer fire departments. What would we do without volunteer fire departments? Because they are critical in terms of addressing both issues of fire, but EMT and all this stuff. And a lot of these people are burning out. So if the arts can help them deal with the trauma of that, or responding to all manner of different challenges coming up, that gets public health people their attention. And as Napoleon was talking about, if the arts can help communicate to people that it's important to wear their masks, that it's important to do all manner of different things, or just to get them moving and dancing, so you can, let's say somebody with dementia, so people get to see their parents in a new light and reconnect with the joy that they've always had. So these are some of the marvelous things. So I think
I just wanted to say real quick about our regional network, because I feel like that is an area that people can really reach this. I realize for some people who are not in this world, it seems very hard to imagine how to get into it. And so part of the idea of having Arts and Health California is that people can come to periodic meetings, maybe every 3 months. They can meet each other. They can We can have a mentoring program. So there's a lot of ideas around the Arts and Health California. And so if those of you want to get involved, we'll send that the links to California for the Arts to share with you.
Yeah, and again, you're also lucky that NOAA is based in California. So you guys, this is like, guys, you guys have like insider, the home team advantage. Right. So I want to turn this.
Nash, it's Julie. Can I just jump in for a second?
I was just going to turn it back to you. Your timing is perfect.
Oh, well, that's okay. Our time, we're on the same wavelength. I actually wanted, because Californians for the Arts has been working on this concept of artists as second responders, right? This idea that we are really providing, and when I say we is the collective of arts and arts organizations across the state in particular, are providing services that provide that hope and that healing that you're talking about in direct ways are intersecting in hospitals and in your programs that you're talking about here. But could you talk to, because this was actually a question and I'd love to ask this directly of the panelists here, what are your thoughts in response to this idea, and what might make it to get the broader public and funders to think of the arts in this way? So how do we translate it from a concept artist as second responders where, we're within the know, we feel that way, but how do we broaden that out there? What do you think of that idea, and how would we get that out there? Your thoughts on that?
In a nutshell, through storytelling. There's so many incredible stories to be told of how artists of all sorts of different backgrounds. There's this marvelous musicians are getting the homeless in Los Angeles to write songs and to sing. The amount of work that's been going on with the military community. San Diego, by the way, has more veterans per capita than any other county in the country. And there's been a growing use of the arts to help them express their feelings and help them deal with the trauma of the outcomes of their service, whether it's TBI, traumatic brain injury, whether it's military sexual trauma, whether it's PTSD, the arts being profoundly important. So I would say the most important thing, and this is a great opportunity for us working with you, Julie, and for all of you listening, if you have some great stories, send them to us, because it's what it is. If you can help Julie and us tell your stories, you guys are doing great work throughout California, and we need to capture those stories and tell them. We can tell them through short videos, we can do lots of different things, but it's all about storytelling. And there's the other thing is, of course, is critical, is research. The National Organization for Arts and Health is big on research. There's been a ton of research done, especially through the Creative Arts Service. A lot is extremely valuable. But one of the things we found out when we brought these CEOs together is that a lot of it wasn't ringing their bells. So we need to do the type of research that's going to get the attention of a hospital executive or public health executive. And that's why, as an example, we can really demonstrate how the arts can help make a difference reducing burnout. We've got their attention, because you keep one nurse from walking, you can pay for an entire arts program. You keep a doctor, oh my God, I could put on arts programs in about 20 hospitals. So it really adds up. So it's important to do research, and it's important to tell stories.
I just want to add that I agree 100% with Nad said, but the field is at a tipping point today because of the robust evaluations of projects and studies, return on investment studies. And one of the things that NOAA promotes and teaches is how to design a program that has a pre and a post that we can evaluate. So what gets the voice, and when I sit down with a CEO for the very first time, I show them the studies that have been done. And I show them how they can put programs together with credible studies, partnering with their research people. And how we can do this in public health. And we have a great example here in San Diego. It's a project called Voices of Our City, which is a project that was started by one musician who walked the streets of the barrio of San Diego and said that creating a community choir of homeless can bring these people out of poverty. And so she did. She started singing. She found a place. You know, now there are over 150 people from San Diego that are homeless, that, you know, many that were homeless, because partnering with the different social service agencies, we've got them off the street, they're into apartments, they have healthcare, they're in drug addiction programs, and it all started with the arts. It got the attention of our mayor, it's gotten the attention of all kinds of public funding. It started with one artist who was passionate. There's a similar program in LA. There are programs like this all over the city, but they've done credible evaluation studies. And that is the difference between moving into the next century, you know, with arts and health, or arts and public health, and just being another fluff to society.
Yeah.
I agree. I want to add to that.
Yeah.
My apologies, Nash. Yeah, with quality over quantity, we received over, I want to say, $100,000 in funding due to our outcomes and our ability to show the efficacy of the arts in addressing stress symptoms or depression symptoms. I think another thing that we can do to bring artists as second responders to the forefront is actually increase representation of us as artists. You know, one of the things that we do within QOQ is we actually pay the community members that actually go one season of quality over quantity programming. We then actually give them a job to come back and to co-facilitate the program. I think one of the things that I see happening significantly in the field of art and health is the stigma of art. You know what I mean? Often I think it's easy for people just to look at it as like, you know, hippie kids, you know, some foo-foo, but like, no, man, this is a hard science. And I think the more we can not only demonstrate that with our research, but then also too with how we're paying our artists, you know, because I think it hurts the culture when we have artists doing so much and not getting paid for it. Who wants to be a second responder? You know what I mean? It definitely creates a stigma around that. So I think, as Naj said, yes, continue to do the research, and at the same time, continuing to try to connect with organizations like NOAA so we can create jobs like we're doing in this response to COVID-19, so people can see that, like, yo, there is a benefit to being an artist.
Yeah, so what I want to, again, emphasize to you, part of this thing is we need you to tell your stories to your elected officials in Sacramento, in City Hall, and Washington. You can show art matters profoundly in people's lives. The arts can help provide dignity. They can help people feel heard. They can help people have a voice. They can help people learn new skills. And you know, these artists, when you reach out and you give somebody that opportunity to express themselves through a poem, through a song, you're an answer to somebody's prayer. You're like, and that's a powerful thing. So we need to tell our stories, and you need to support, you know, the Californians for the Arts. Julie and her team are doing a great job, but they need you. They need your involvement, your active involvement. And arts and health, we're making a difference in people's lives. And the wonderful thing about artists, they can talk to anybody. They can talk to the wealthiest, the poorest, no matter who they, I mean, you know, we're communicators. And also artists are very good at observing and listening. That's part of that's how we get to do what we do. So
Nash, I want to say thank you for that. And one of the things, you know, people, and what you said, Napoleon, in terms of paying artists and how critical that is. And part of our reasoning for saying artists as second responders is to try and make that correlation to artists as essential workers. And I think that there is often this sort of, yes, thank you so much for providing the hope and the healing and the service of your art, but oh, I just expect to get that. I don't expect that I have to pay for it. And we really need to make a broad cultural shift where we understand that this is professional, this is a service, this is many people have invested a lot of time and their own money to get to where they are as artists, and how important that is that we see the correlation to funding and investment for artists artists as well. And that's why I think we're really trying to build that concept around arts as essential and artists as essential workers in providing this type of service. So thank you so much for showing exactly how that's making results happen in these programs, and in particular in the issues around disparity, and how that cultural connection is so critical for people to feel like they are coming into something that is not so foreign to them, but that is a part of their own communities. And so all the work that all of you are doing is incredible, and it's so great to have you here as part of Californians for the Arts online learning. And we will be sending all of this information will be on our website for everybody. You'll see, we'll get all the Annette's PowerPoints, we'll get a copy of the video, we'll send you links to everybody's programs. And I know there's more questions, but we have to honor that it's 11, so.
Yeah, and our contact information, a lot of people, how do you reach Annette or Cindy or me or Napoleon? Our contact information will be on the website. And so you feel free to contact us with your ideas, your questions, whatever. And, as Julie was saying, the artists who work in arts and health, or the creative arts therapists or artists, they're highly trained. And absolutely, they need to be compensated because they're highly trained. This is important work. Thank you.
And so on that note, we want to just thank everyone here, and also make sure that if you are someone who believes that artists should be invested in and should be paid, and that these types of programs should exist, please also make sure that your elected officials know that. We have lots of opportunities for you to be advocates on our website. You can go to californiansforthearts.org. to pull down on the ACT menu, and you'll see all sorts of advocacy actions that you can take right now to make sure that even in the midst of a public health crisis, we can prove how artists can be effective in helping during this crisis. And we want to make sure that lawmakers are aware of that, not only recognize that, but also understand the importance of investing in the arts. So I want to thank all of you so much for giving your time today. So great to see you all virtually. And maybe we'll just have to do a part 2 on this. I think there's so much more. There's a lot more questions. So we'll be in touch with everyone here who's listening. Thank you to everyone, and have a great and safe day. Stay healthy.